Everybody, it's Dr. Eric Balcavage. We're back for another edition of the Thyroid Answers podcast. And today I have a guest. I have Dr. Lonnie Herman. He's a chiropractor. I've known him for, I probably met him, I want to say 20 years ago. It makes me sound old. We still look young, but it seems like it's been a long time since I last talked to him. So Lonnie, how you doing?
Excellent. Excellent. I'm glad to be here. I thank you for having me on and sharing this work with your listeners.
Sure. So, Lonnie, you've been involved in healthcare. Your initial background is a chiropractor, but now you're working with people with chronic health problems, chronic illness issues. How did you get on this journey? Where did you start from? Because where you started as a chiropractor to where you are now is probably a little bit different. Is that fair to say?
Yeah. I realized as a chiropractor pretty quickly when I came out of school that people with chronic ailments, whether it was even just chronic pain, whether it was neck pain or back pain or like a carpal tunnel or nerve pain in their foot, it wasn't, in a lot of these people, the symptoms weren't getting relieved with chiropractic. And I thought when I came out of school, it was the be all end all, the ultimate thing to do was to get the chiropractic treatment and provide that for a person. And when I saw migraines weren't going away or like somebody's blood pressure didn't come down, and the school I went to was very a principled chiropractic only type of school. And I realized pretty quickly that it wasn't the answer for everything. And then I just started expanding my knowledge. I went to some of the courses that you probably went to as well, and postgraduate studies in neurology. And then I took neurochemistry and immunology and endocrinology and thyroid disease and developmental disorders and other courses. And what was pointed out to me especially in the immunology studies were that there were hidden infections and toxins that got in tissues. And once I saw the proof, and these were the PhD, the immunologist who was instructing the course, who had probably about 40 years in the immunology arena, who's pretty well known. He showed us proof in journals that came from labs around the world that were not funded by drug companies. The drug companies are the ones that are they want the study to be that the drug is the answer, the medication is the answer to stop the disease or relieve the symptom. And so, but these scientists were showing that there were deep-rooted infections, like parasitic infections in the joints that made the rheumatoid arthritis occur, for example, or mercury from a tooth could be on the thyroid, making their Hashimoto's disease occur, for example. So that is what really turned my attention towards figuring out a way to find these different infections and toxins in tissues, in specific tissues. And so that's where we are now.
So you're helping people with chronic health issues. You've developed some processes and techniques to help address that, and doing what a lot of us do is trying to help people recover their health and their well-being via your technique. So we've probably never been sicker than we are now, right? We've got some of the best technology going. What do you link to the high propensity of chronic illness? I mean, we used to say that we were living longer every year. And so that was the people would say, well, obviously it's a testament to modern medicine that we're living longer and longer each year. But in the last 2 years, we're actually living shorter lives. And there's this thing called lifespan, and then there's this thing called health span, and then there's this thing called disease span. And even though we still have a fairly long lifespan, we've continually increased that disease span, how long people are struggling with chronic health and chronic illness. So given we have fantastic technology and we've got this massive beast of allopathic medicine, why are we struggling with so much chronic illness?
Again, I go back to what I said before, that there's chronic infections that get into the tissues. There's toxins. I think that there's also, if we talk about the psyche of the individual in this country and possibly in other countries, that, the news, the mainstream media, the magazines, the TV, the radio, and so on, I think it's funded in big part by big pharma, and even the governments are partly involved in that. And unless and until we can actually find those, again, the deep-rooted infections and toxins and eliminate them and literally neutralize them, eliminate them from the tissue of the diseased person, that disease, as you said, the span of the disease is going to lengthen, and the condition of the person, of the individual, is going to decrease, and they're going to live with these long-term chronic diseases, especially in the past couple of years with COVID and now the vaccines. There are certain treatments that were recommended, and we're seeing in the news now that they were not really effective. We've seen great effect with our work for that condition, but yeah, I think that the lifespan is longer because the drugs keep people alive, but they keep them with the disease. They keep people alive with the heart, the congestive heart failure, but they're keeping them alive. So congratulations to the drug companies for, without hospitals and without medications, people would not be surviving as long, but they're surviving with the disease. They're not surviving without the disease. And we've got to find those infections and chemicals and get rid of them from the body to see rejuvenation of the body and see a better quality and longer quantity of years for the person.
All right. So I think it's important to say that even though allopathic medicine has its place. And so I think it's important to say that, because their focus is on helping with acute care. They do really well with acute care, crisis care. Argumentatively, we could say that they do good with managing chronic illness as it gets worse. But at the root of functional medicine is trying to identify root causes. So when we talk about what's the root cause of chronic health issues, and somebody would say, well, what about a thyroid issue? What about a gut issue? Whatever. You're saying your thought process is that most of these chronic illnesses are the result of either toxins, environmental toxins of some sort, organism toxins, or organisms themselves.
Absolutely. And I can expand a little bit more.
Sure.
But yeah, that's generally, I know from my studies and now my research and my experience with people and helping people overcome these chronic diseases, and sometimes very rapid, and sometimes it takes, several treatments, several visits. We have certain stresses that can occur from dental infections that are very common, right? So it's still infections, but there's rooted in the teeth. There's the toxins that are in the teeth from dental procedures. We need the dentist, of course. I'm not knocking them, but certain toxins like the anesthetic that's injected into the mouth to fill a cavity or pull a tooth, that can seep right from the tooth right to the thyroid or to the liver and make the disease occur in that tissue of the body, and it will stay there, and it doesn't just detox simply out of there.
So let's break that down for a sec. So yeah. I totally agree that we can have oral infections that can trigger systemic infections, right? We can have toxins that trigger immune-based reactions. Usually toxins, according to some people, and maybe your research shows different, but that the chemical toxins the chemicals aren't large enough to typically trigger an immune-based process on their own. We see these chemicals bind to tissue, the combination of the chemical and the tissue. We have a neoantigen, and now we have potentially an immune response to something. So are you looking at and we have systems in place, right? So if we're exposed to, I don't know how many toxins we're exposed to on a daily basis. So if we're talking about the toxins creating a problem, we should have systems in place that helps clear those toxins out of the body. Why do you think those toxins are staying? Why is a toxin from the oral cavity going to the thyroid gland? Why is this system not in place to clear that out? Or what's causing that system to break down in let's say in the role of a toxin?
Are you saying the system of the human body, like the kidney or the lymph, or is that what you mean, the own detox systems of the body? Or are you saying the system of medical alternative care?
No, our human physiology, right? Yeah. So the human physiology is built to have detoxification processes in it to say, hey, let's move this stuff along, right?
We think that.
Okay, so give us an understanding a little bit more of what your thought process is. Does the body not have processes to help detox these things, or why do these things get stuck in specific tissues?
Yeah, so I'll give one point just to say that. I've got a few points about that. So one is, if we just look at like somebody getting a tattoo ink put into their skin, the body's not able to drain that ink out of the skin and just like flush it out of the body, and the tattoo disappears. So the lead and whatever else was in that ink stays in the skin, and some of it will seep into the bloodstream, because we have blood vessels, capillaries, and so on that are at every stitch of tissue, including your skin, everywhere in the body. So it doesn't detox everything. number one. But number two, if you think of a study that was done by the Environmental Working Group back in 2005, and I think part of it was funded by the Red Cross, this body burden study, and your listeners can look it up, body burden, 2005, and my EWG, or Environmental Working Group.
Mm-hmm.
And they went across the United States, in different states, different cities, different hospitals, and there was not one hospital or city or state. It wasn't like Flint, Michigan, where they knew lead in the water or something wrong in the pipes. They just went any city, any state, any hospital, USA, any newborn infant. But these infants, which just came out of the mother, still attached to the umbilical cord, they had to be healthy, seemingly healthy at birth. There was no leukemia, there was no Down syndrome, there was no genetic disorder, no missing limb, there was no thrush, there was nothing wrong with these babies, seemingly. They took biopsies of the baby's tissues right there at birth, and they took samples of the mother's umbilical cord blood, and then they detached the baby from the cord. And when they studied these biopsies of the baby's tissues, they found 200, and these were healthy infants. They weren't vaccinated yet either. They found 287 toxic cancer-causing chemicals in the baby at birth. They found the same in the mother's umbilical cord blood. We're talking things like plastic, lead, arsenic, mercury, chlorine, fluoride. They found weed killer spray. They found pesticides, insecticides. They found styrofoam. They found birth control pill residues, antibiotic chemicals in the babies at birth, and there's many more, 287. Mm-hmm. I mentioned not even probably 10 or 20 just now. So when the body is already burdened, as the name of that study, the name of that report, the body burden, the body is already loaded, and we think we're functioning at a very high capacity if we're healthy as an infant. So if we're already loaded with, let's say it wasn't 287 and you or me, maybe it was, DDT insecticide, and your mother had an epidural to give birth, and these chemicals stay, and they're in the infant because we come from our mother. We're connected to her for that 8 or 9 months. And so anything that we were already burdened with that's decreasing the effectiveness, the function of our lymph, decreasing the function of our kidney, decreasing the function of our liver and our sweat glands and so on. What would happen? What's not happening is every infant who's born is not being tested right away for the amount of toxins and infections that they're born with. Mm-hmm. For one, and every infant by month 6 or by month 12 or by month 18 or month 24, how many of these infants are being tested over and over again to see how many toxins are in the tissues or any of these toxins coming out of the tissues. So since we're already burdened, it's kind of like if you put paper towels down the toilet and flush the toilet and the pipe gets clogged, you can't flush anything else until you clear that. So we need more better strategies from early on to start flushing out the system that we're not, because we're so burdened that the body's not totally capable of. And then let's add on to being burdened already at birth. Now, many people are vaccinated with multiple vaccines and multiple times right there at birth. And sometimes children have ear infections and croup and so on, or they get a cough and they get a fever. So they're given injections of like penicillin and other antibiotics, and then we've got foods and the mother's breast milk. If they're being breastfed, there could be some toxins that are actually literally coming from the breast milk. And so it's just overwhelming. There's just too much. So I feel that when, let's say, somebody was 20 years old and had a cavity filling or a tooth pulled or the wisdom teeth pulled at 20 years old, let's say, and that's their first and only dental procedure, the numbing chemical that they put in the mouth and seep right down to the thyroid, like a stain, like a tattoo ink in the skin that never just leaves the body because our detox systems are working great. Even if we did infrared sauna and we did steam baths and we did, liver detoxing and kidney detoxing and lymph drainage and coffee enemas and all these different things, the ink is still in the skin. So just like the ink stays in the skin, the dental anesthetic, and we're already burdened since birth with too many toxins and infections. And as we've accumulated more in life from pesticides and all these other things, arsenic in the bottled water that we buy in the store, and lead and other things, and radon from the soil. There's so much coming at us that I really believe that the body it's just too much for many people to handle. And then we see these diseases, whether it's autism, or we see that there's attention deficit disorder, or we see somebody who's 15 who develops lupus, or somebody who's in their teens or 20s developing multiple sclerosis or early cancers and thyroid disease and you name it, attention deficits, and it's all based on this. It's all based on this. It's just too much that we're overloaded already.
Well, I would agree that we're overloaded, right? I agree that we're bombarded by things. I agree there's a load that we push the excessive stress load beyond a point where cell physiology shifts from homeostatic regulation to more of an allostatic regulation. So going away from manufacturing mode and focusing more on cell defense physiology. I agree with that part. The issue becomes we are bombarded with toxins, right? But I think we do still need to give some credit to the physiology, and I'm sure you are, that, hey, the body has a system in place or multiple systems in place to try and keep that burden at bay. But I think what you're saying is that what you're finding maybe in your patients with chronic illness, their system for detoxification, for clearing these toxins is compromised to some degree, and therefore their burden is becoming more problematic. Is that fair to say?
Sure. Yeah, absolutely. You're right. I agree with you. I'll also say that, it's not just, and you didn't mention this just now in that statement, but the 20-year-old who develops lupus, that can be a deadly disease for a person. It's not, maybe somebody lived and they were like a champion boxer, a champion, decathlete, or they're a champion gymnast, or a singer or a pianist, or somebody who's really developed incredible skills, and they're loved by many and millions around the world. And then all of a sudden, in their 60s or 70s, they develop Parkinson's or Alzheimer's or dementia or whatever other condition. And so, yeah, we can have, a healthier person live for many years, but then the burden became too much for their brain or their body to handle in the later years of their life, and these other diseases develop.
Oh,
Like an Alzheimer's or Parkinson's.
Yeah, I totally agree with that. I mean, there's a point, I don't think there's an on-off switch, right? It's not like, okay, I was good, now I've exceeded capacity. It's a progressive thing for a lot of people. Now, we know when we hear people's stories, we hear look at their health timeline. Usually you can see the building load of stress on their system from trauma, emotional trauma, physical trauma, toxicity,
absolutely.
right? Infections, medications, all this load that at some point, the small thing triggers. I just developed thyroiditis. Nah, I don't think so. You've probably had compromised cellular physiology for an extended period of time. Now you're seeing that excessive response, chronic response, and now you're seeing the thyroiditis that's occurring as a result. Yeah. So we know toxins create a problem, right? So the problem is that we're going to have that discussion, and listeners are going to be thinking like, but I'm bombarded by toxins. You're telling me all these things are going to create chronic illness. If I don't have a system in place to get rid of these things, I'm doomed, right? So where do you think the link comes from having ability to clear some of these things out? Or don't you think that we typically have those systems in place? I guess that's the first place to start. Do you think we have systems in place to clear a lot of these toxins that we're exposed with, or do you think we're not clearing that burden on a regular basis?
Well, two thoughts. One is there are some who can't, and there are some who can clear some of these toxins, but not all of them. So it does build up over time to where there's some kind of problem later in life. So there are children who I've seen, and we just had somebody come in here. If I can give an example of a patient, she came in, about her mother brought her down from Louisiana to my clinic in Southeast Florida. She 18 months old. We met her the year before. She had a rash. We helped clear up that rash very quickly. And she brings her back in here. She was frantic on the phone. She has to get in to see me because the daughter one day was fine. The next day, she developed this autistic behavior. How did that happen? She was banging her head and pulling her hair and screaming and wouldn't let anybody but the mother near her, very anxious. And my history taking and what happened here, I'll tell you, just in 5 minutes of treatment, we fixed it. Okay. But what I found is that her symptom of banging the head and constantly and pulling her hair and screaming and wouldn't even let anybody near her but her mother was, it happened. She had an ear infection and a fever. They went to the hospital. The hospital gave her an antibiotic right there. Now, I was thinking because the doctors had to pin her down on the table to pull her blood, and the girl was freaking out and crying. So I thought, like a post-traumatic stress disorder, emotional stress happened from that? Or was it the antibiotic they gave her right there in the hospital? Now, the antibiotic was successful and the hospital was successful at decreasing the fever and stopping the ear infection, but she woke up the next day, no fever, no ear infection, but she woke up banging her head and pulling her hair and screaming and wouldn't let the mother sleep for a whole month. And it continued for that month. And I found that antibiotic with my method. I found the antibiotic in the frontal lobe of her brain. The body couldn't clear it. And we gave her the remedy for that. And how do we know it worked? And we were right on, because not even 5 minutes passed after we gave her that treatment, the whole disorder stopped. She's smiling. She let people near her. She was high-fiving everybody, little girl. Spoke with the mother 3 days later. Everything is fine. So that's one example. But, how long could the body, even though the mother was under stress, severe stress, emotional stress, and crying with the daughter for a whole month and crying here in the clinic, how long would it take if the body could clear that antibiotic that stayed in the brain? Would it take a year? Would it take 2? Is that possible? I don't know. I do know that there are people, and from other functional medicine studies I did in the past, like, for example, a urine heavy metal test or a hair heavy metal test, I would run that in every single patient, amongst other tests, other labs I run on people. And what I started to realize, especially after that immunologist, and I called him on the phone, Doctor, or am I blank on his name? I'm sorry. I'm sure you know him. Anyway, I'll get back to his name in a minute if I find that in my memory. But
Are you talking about Dr. Bujidani?
yes. So he showed in a picture in the immunology class where the dental mercury went to the thyroid. Okay, I'm going to come back to the urine and the stool test example in just a moment. I called him on the phone and I thanked him so much for opening my eyes and my mind. And I said, I'm curious because we're learning how to run all these different labs with stool testing and breath testing and adrenal testing and hormone testing and food sensitivity and leaky gut and all these different things. And I was running those on and genetic testing. I was running on every patient. And I'm running hair and urine heavy metal testing on every patient, everyone. How am I finding if there's dental mercury from the amalgam in the tooth? How am I going to find it on the thyroid? And his answer, I don't know. I said, but the labs that we're learning to run, no. He said, it's not going to find it. I said, how am I going to find it? He said, I don't have an answer for you. Go out and look for that. Go out and find it. So I was stumped. I was like, the immunologist can't tell. I'm not going to take a biopsy of the thyroid and find that. You told me that could be right there. They found it in labs when they took biopsies of tissues. How am I going to find that amalgam on the thyroid? So he left me with, I was actually pretty depressed after that. I was happy to meet with him and discuss with him, but I was pretty depressed after that phone conversation because now, like, how can I find this out? So anyway, back to the urine and the hair heavy metal testing. We can find, for example, that let's say there's mercury or arsenic or lead in a hair analysis. And if we ran the urine analysis, what we're seeing with the urine is that there is some clearing of that lead or that mercury or arsenic or whatever it is that was found. And the thing is, you don't know, no physician can really say that they know where that metal in the body that's coming out in the urine is coming from in the body. Was some of it stuck in the kidney and the kidney has been processing? Let's say, for example, that they drank bottled water, like even a Whole Foods brand. I'm not talking bad about them. I shop there, but there were studies that found there was arsenic even in their bottled water. So let's say we drank that water and that arsenic from that water got stuck in the kidney and the body is processing through the kidney, but some of it also went to the brain and it stayed there, or went to the bone marrow and it stayed there. How can we find that it's there in the bone or in the brain, and how can we find that that's what's actually coming, where it's coming from when we run a urine heavy metal test? We can't prove it that way.
Right. So there's problems with the urine heavy metal test because we don't know if what's coming out is the result of just great detoxification and we're clearing it. We don't know if that a negative on a urine heavy metal test indicates that there's no toxin, or the fact that it's not being released at all. Right. So we
100%.
We don't really have those tests are questionable because they don't really give us an idea. Just because you see, I think it's the same thing when we start to look at people who say, hey, I have a mold, I have a mold issue because I did a urine test for mycotoxins and there's mycotoxins. Well, shit, everybody is exposed to mold in their environment. And if you're exposed to it and you're getting some of those toxins and you're releasing those toxins, isn't that a good thing? Does it mean just because everybody's exposed that that's triggering an immune or autoimmune or a chronic inflammatory condition? I don't know. I don't think so. But there are challenges with the testing we have because we can't often look inside the cell and tissue without something like a biopsy. And somebody's only going to probably let you do that to them once, right? You're not getting that done on a regular checkup. So how do we look at it?
So the method that I work with, and all very good points you just made, and let me just go back and just agree with you that could the mycotoxin that's in the person cause the reaction? I do think it does automatically. It's just what type of reaction is happening. Will one person just they can't sleep through the night and it's not really like they're having pain in the body, or is another person that they can't lose weight, or they have a mild headache that comes and goes, but it's not really interfering greatly with their life. So they don't see it until it becomes so bad, like they have a Graves' disease developed, or they have a serious Hashimoto's inflammatory, it's like they lost their eyebrows and lost their hair, or something like that, and or other conditions. So,
but don't you think that the wisdom of this physiology, right? That we get exposed to these things, and the wisdom of this physiology has the ability at times to say, hey, I got this. I know what this is. I'm going to address it. I'm going to eliminate it.
I think that's some of it, but I think that we're burdened too much, that the body is weakened from birth, even before birth. The DDT is not natural to the body. The glyphosate weed killer spray is not natural to the body. Mm-hmm. Is the body really up to par? Did somebody get, how many MMR injections? How many tetanus shots have they gotten? How many anesthetics have been put into them and sedatives? Have people done street drugs? Have people taken multiple antibiotics? It's an overwhelming amount of stuff. And now we got mosquito bites that can give us parasites and viruses, and people just coughing and sneezing around, with the whole mask, which I disagreed with, but there's just so much that we have going on. And again, there are people who are just incredible athletes who live very healthy until they're 90, still doing a marathon. And there are other people who are living with terrible disease at a very early age. I mean, in their childhood or their adult years. So I think there is a possibility that we are detoxing some. I just, the people who come to my clinic, and probably yours as well, they're not like the epitome of health. They're not the person who's running triathlons and they're just like ultimate healthy and saying, hey, I just want to see how you can help me clean myself out. The people who come to probably you and people that definitely come to me, it's like the worst of the worst.
Right. So I think that we have to be careful, right? Because we start to see what we see and we have our bias that the physiology can't do it. But I would argue the point that we can't work on some of these things, or the system isn't set up to help address these things. I think when we come from two individual cells and we create what we've created, that there's a wisdom there that the body can manage quite a bit of a load. But for a lot of people, we exceed that load. And we've got people that are athletes that are chronically ill. I take care of a ton of those people. And we have people who aren't athletes, who don't do aren't really careful with their health. They're smoking, they're drinking, they're doing all those things, and they're still living into their 90s. So I think there is something to this innate intelligence that we have inside us that has the ability to address those things. But I do agree that there is a burden and there is a load. And for some people, we exceed that capacity that puts us into this allostatic regulation really, really early in life. And for some people, they're able to work their way back out of that allostatic regulation into homeostatic regulation. But for a lot of people, they are stuck in allostatic regulation. And what happens then is, hey, I need to, in my perspective on thyroid physiology, you might have a different one, is that when we see this thyroid issue going on, I don't look at the thyroid breakdown as this broken physiology, at least not in the beginning. I don't look at it as an immune system out of control. I look at it more as an adaptive response. If I'm in a low stress homeostatic regulation, I'm making all the energy I need to do all the things I need to do. I want a lot of conversion of T4 to T3 because I'm turning on the manufacturing process, and that high T3 state in the cell is turning off or turning down that immune inflammatory cell defense process. But if I'm in danger and I'm a cell and I'm perceiving an infection, a toxicity, what do I want to do? I don't want to turn on the manufacturing process. I don't want more thyroid hormone being converted. What I want to do is I want to downregulate that T4 to T3 conversion because I need a lower metabolic state in the cell, because that helps me with the cell defense mechanisms. And then eventually, and maybe we'll get into it as we talk about organisms, these cells in danger produce DAMPs and PAMPs, which I'm sure you're more than familiar with, and that can, those DAMPs and PAMPs bind to toll-like receptors on the thyroid cells and initiate a thyroiditis. And those antibodies that get all the blame for being little Pac-Man eating up the thyroid gland really do not create much, if any, damage to the thyroid gland itself. So I think to keep it on a positive note for people, we want to say, hey, there are systems in place that can do this, but for those that are struggling with chronic health and chronic illness, you've exceeded that burden. And that's what I think our job needs to be, is helping those people identify their burden. Is it toxins? Is it organisms? Is it emotional trauma? Is it physical injury? Is it, is it poor respiration, right? Because I got this chronic inflammatory state, and now I've got poor breathing, and so now I can't get oxygen to the tissue. It's creating hypoxia. Now I'm in that same mode. So there's a lot of things, but our job, I think, should be helping people uncover those things. And I know that's what you're doing, so we'll continue on that discussion. But I see where we're slipping in functional medicine is we have people, and I give them kudos for coming to functional medicine from an allopathic model. But unfortunately, they're bringing the allopathic paradigm, which is, hey, we'll replace that drug with 4 or 5 supplements, and that's better. And I just think that's more greenwashing of medicine. It's the same paradigm. It's the same philosophy. And I don't think that's what functional medicine is all about. So if you want, you comment on that part, but then I want to kind of get into the organisms a bit.
So, yeah, I'm interested then. So because you're doing functional medicine, yes?
Mm-hmm.
So what is your outcome for the patient? Because when you're saying not to replace the medication with the 4 or 5 or so supplements, what is your goal?
So my goal is to identify and reduce the stress load the best we can, right? And then support the recovery back to health. Now how do we do that? Diet, lifestyle. We do use some supplemental strategies, but they're not, they shouldn't be, hey, here's my 2 bags of supplements, but we should use supplements like we use diet, nutrition, and respiration as a tool, and then get them back to a restorative mode. And then long-term, what's the best thing? Doing all these kind of healthy lifestyle habits, to support better function, not relying on bottle after bottle after bottle of supplementation.
So you're saying you're able to get them to a point where they wouldn't need to take that supplement to just keep the body functioning at a better pace?
Absolutely.
Yeah, I agree. Okay,
it's the same thing with my thyroid patients. When I'm working on my thyroid patients, my goal is, even though I don't prescribe, right? That's not our job or our role. But when we're talking about it, my ultimate goal with a client is to get them to a point where they need as little thyroid hormone as possible. And for quite a few of them, that's none at all over time. But it takes time for a thyroid gland that's been damaged over time to actually start to recover. But you have to remove the triggers that initiate the chronic thyroiditis. And that often is never done in both allopathic medicine or functional medicine. I think what happens in functional medicine is you have the practitioners looking at a thyroid panel saying, hey, you're not converting T4 to T3. So that medical doctor is doing the wrong thing. They're only giving you T4. I'm going to do a better job. I'm going to give you T3 as well. But my question would be, if 95% of the T3 is made in the peripheral tissues, not in the thyroid gland, do you think that one day the person woke up and forgot how to convert T4 to T3? Or do you think that's more of an adaptive response? And my belief is it's more an adaptive response. And then if that's the case, does jamming them with more T3 fix the problem, or does that create more stress on the system? And I would argue it creates more stress on the system. So I think what we're doing quite often in functional medicine is the wrong approach.
Mm-hmm.
So.
Yeah. I'll say, if I could just add to that, remember when I took the neurochemistry program with the neuroimmunology, and one of the comments that was made on the very last day of that whole program was, don't try to do for the patient what the and I'm not knocking medicine. Please don't get me wrong when I say this, because we have to appreciate everything has its place, right? But let's say somebody with Parkinson's is on dopamine. Don't try to replace dopamine with some type of dopamine supportive supplement and think that you're doing the right thing for the person, because you're keeping the body dependent on something if that supplement is going to be as effective as the medication. If the medication was successful for the person, but the person wants to try to transition, help to, clean out their body and not live on the medication. Because some people take, for example, with Parkinson's, they could take the medication and it does nothing for them, or very little for them. Or it lasts only like, 30 minutes or an hour or so, and they have to keep taking the med, and they keep upping the med, 5 pills a day for some people. And to where sometimes that doesn't even work for them. So what this professor said was, don't try to just replace the medicine with the supplement that's supposed to do the same thing as the medicine. And he said and his point was, if you can find the cause and rid the cause, how these chemistries are made in the brain and where they're going to in different parts of the brain for the brain to control let's say the limb with a Parkinson's patient. Find the cause of what would decrease the production of the dopamine, find the cause of what would decrease the receiving site for the dopamine received into the frontal lobe of the brain or the thalamus or so on. Find that cause or causes and rid them, and then let the body just do it on its own. And that was one of the key points as well that made me start to really think, like, what is it? What is it? I'll tell you, I remember with functional medicine when years ago, a woman with terrible depression and anxiety, and I took the first neurochemistry course, and I said, all right, I've got the answer now. I'm going to have her fill out a certain questionnaire, and it looks like she needs some serotonin support. She was already on serotonin medicine and anxiety medicine for depression or anxiety. And the first supplement I gave her, and didn't take her off of her medicines at all, but just gave her this other serotonin supposed support remedy from a certain company. And she came in, it was like a day or two later, she was crying and screaming, and God, please take me, I just want to die. What the hell? Oh God, this is not something to play around with. I didn't really understand it yet. And I was lucky that I figured out which supplement to give her, and she felt better. But then let's go 6 months into the future, when she was done with the care and done with the supplements, she just said that she felt the same. She was happier. I mean, she told me this is like the best I felt in a long time. But now, months into the future, she was just like, I feel the same as I did when I first started. And that was probably about like 10 years ago. And I just said, what is missing here? What is, doing liver detoxes and oxygen therapies and functional neurology and all these different strategies and trying to reset the adrenal gland and all these different things. And I just, something was missing. And, but going to the organisms was your next topic. Those definitely changed the brain's performance and changed the organ and the gland's performance. So if you want to open up that discussion.
Yeah, let me tie into that, because I think a paper by Robert Navio, I don't know if you've read that paper on the cell danger response, but a paper by Robert Navio really kind of cemented this idea. As I was taking some of the same courses you were, and I'm looking at this stuff, and I think we're kind of being taught that this is just broken physiology and you need these supplements to fix it. And I always struggled with that idea and that concept. Like, how does everything just break? Like, how does the immune system just totally not recognize our own thyroid tissue or other tissue? So there must be something else. And why do people take these supplements, and some people seem like they do well and some people don't seem like they do well?
Right.
And when you read Navio's paper and he talks about the cell danger response, it kind of cemented that for me. And that's where I deviated from Datis's work about thyroid physiology a bit. I'm like, listen, this isn't broken physiology. This is all part of this excessive cell stress, cell danger physiology. You need to downregulate thyroid hormone to help initiate some of that cell defense physiology. But Navio in that paper, although he missed the thyroid piece in that paper, which I did ask him about, he's like, well, I don't know much about thyroid physiology. But he showed in there that in different situations, tryptophan does one thing in a low stress state, tryptophan does another thing in a high stress state, right? B6 goes one direction at a low stress state, B6 goes a different direction in a high stress state. Vitamin D, what happens to it in a stress state versus an unstressed state. So we think in functional medicine, I'll just give it to them and it's going to do what I want it to do. And then we're kind of perplexed or confused when it doesn't. right? We learn, hey, if they have got a serotonin deficit, to go to your example, you just give them these precursors and it's going to help them make serotonin. Well, that's only if that's what the physiology needs in the moment, is more serotonin. But in a situation, as we're going to kind of segue into organisms, in a situation where you have a chronic infection, is more serotonin really what the body wants to do with that tryptophan, or does it want to drive that tryptophan down more the kynurenic quinolinic acid pathway to be more of a neurotoxic, or more of a toxin to help with that die-off process? Is there a benefit to the cells deactivating thyroid hormone when there's a chronic infection versus converting it to T3? And it seems like, yeah, there might be, pulling that iodine off. What is iodine? It's an antimicrobial. How about that? They use iodine in the hospital where they're going to do things. So there is a wisdom in the body. I think we miss it sometimes, even in functional medicine. We're trying to force the process with supplements and think, well, I'm going to make it work if I give these things. And I think we have to take a step back. And I think that's hopefully along the line of what you're thinking, like, hey, we've got to understand that this is probably not broken physiology, but an adaptive physiology. Now we've got to figure out what the body is adapting to. Is it a toxin, or is it something like an organism? So talk about how you see organisms playing a role in chronic illness and chronic disease, especially when somebody might say, but aren't we loaded with organisms every day, right?
Yeah, so we have the human microbiome, right? We're made up of germs.
Yeah.
We have a virome as well. We actually have viruses that are part of our DNA makeup. Like somebody can have a breast cancer gene. We actually have viral genes. 35% of our genes, again, they're viral. So when we look at, I've got a few points to point out here, but one is when we look at the genetic theory as opposed to the epigenetics understanding of the body and the cell function and disease of the cell. The genetic theory is that when we can study the gene, and the gene is going to say, well, there's, a breast cancer gene, you're definitely going to get breast cancer, for example, and it's been proven wrong. Somebody can have a breast cancer gene to live decades and never get breast cancer and not die of breast cancer. So when it comes to the epigenetics understanding, what the scientists did, and you may have, I don't know if you described this before, but what these epigeneticists did, they took a very powerful microscope, 50,000 times magnification, not like what we did in biology in high school or college of 1,200 times or 1,500 times magnification. These are really, really powerful microscopes that were able to see the human cell, every single function of every tissue within the human cell. And they actually went in and surgically removed the DNA, the gene from the cell, and the cell didn't behave different. It didn't become diseased. It didn't die. It didn't change in its function. It was still breathing the same. It was pooping the same. It was moving its functions within the cell all the same as when the gene was there and now without the gene. So they found that the gene didn't determine the health or the function of the cell. They even, I don't know if any of your listeners know about anything about the cellular function, but there's the nucleus. You might have heard that word, the nucleus of the cell. We were taught in school that the nucleus is the brain of the cell. What these scientists, these epigeneticists, removed the nucleus of the cell didn't die. I mean, if we took our brain off our body, we die. So they found that the cell was not controlled by the nucleus and it wasn't controlled by the gene. The cellular health was not controlled by the gene. The disease of the cell was not controlled by the gene. What the epigeneticists discovered is that emotions played a role in changing the cell's behavior and disease of the cell. And that can even be proven in Masaru Emoto's work, the Japanese scientist who found that water, he was able to study water under a microscope and see that if he spoke to water and said the word happy or the word love or the word tranquility, each and every time that he said the word to the water, when he flash froze it and studied it under a microscope, the water had a certain beautiful snowflake appearance that was unique, always the word love, different and always, but unique to the word tranquility or peace. But when he said hate or I hate you, it looked the same water flash froze under the microscope. It looked like mud, like a disgusting, dirty appearance, but it came from the same water supply. So these epigeneticists found that emotional stress changed the performance, the health state of the cell to a disease state. They found that organisms like molds and parasites and viruses and so on around the cell under the microscope, it made the cell act diseased. They found that microwave energy, like from a cell phone or a cell phone tower or a Wi-Fi modem, diseased the cell. And so, and chemicals near the cell started acting diseased. So
Mm-hmm.
we know that from those studies in epigenetics, we know that the environment is what changed the function of the cell. I don't remember your whole question, but I'll tell you that I think of the human body. There was a study that I read years ago when I was still trying to figure things out. And we're always learning. We got to be humble and realize there's always something else to learn, right?
Yeah.
We're not born or we don't know everything. There's always a great journey in life if we're paying attention and keep listening and learning. But there was a study that I read where they stated that the person was schizophrenic and they removed mold from them, and the person was no longer schizophrenic afterwards. And that also drove me in the direction of like, how do I figure that out? Is it just mold that can do it, or can any other organism do that to a person with a behavior disorder or an emotional problem? And I look at the human body and the brain. It's like we have a car, and if you, let's say you had I don't know, let's just say you have a Honda Accord, and you get in the car and you drive it. The car, it's still the same car, but it's going to perform the way that you make it perform. If I drove the car, it's going to perform the way that I make it perform, different than how you drive. We have different driving habits. And trust me, if my wife gets in the car, it's going to perform totally different because she drives a lot different than you or I do. Same car, but it's going to drive different because the organism, we're an organism, period. We in the body, we drive that car to function different. And so even if, somebody else got in the car and drove it, it's going to perform the way that they make it perform. And the same for the human brain and the same for human body. So when, now we can be born with through our mother, and I'm not blaming the mother. I love my mother, and we wouldn't be here without our mothers, and she's the only one who could do it for us, right? To give life on this planet. But what if she had in her uterus, she had some candida? Or what if she had in her uterus, she had some mold in her, or she was carrying for years the Epstein-Barr virus as part of her bloodstream, and it was in the uterus, and the baby connected to the umbilical cord for all those months is born with candida, mold, and Epstein-Barr, for example, and possibly other things. So when not just the toxins, but when these organisms can get into the baby's brain from embryo to fetus to now baby, and now child's in first grade, second grade, and has a learning deficit, for example, is that learning deficit caused by the vaccines? For example, people think that all vaccines are going to cause problems. I'm not getting all into that right now, but the idea is that the organism, like how I drove the car different than you, could the mold make the brain behave different and not be able to have a good attention span, and they're flunking their classes no matter how hard they try and study. They can't retain information, they can't remember. So when and now let's go with another person, always achieving great in school, and then at 15, a girl kisses her first kiss to her boyfriend, and let's say he had Epstein-Barr virus, and she doesn't get sick, but that Epstein-Barr got through from the saliva to the saliva because they actually kissed, right? And the Epstein-Barr get into her saliva, and now it goes to her brain, and it changes her brain performance, or goes to her liver and stays there and aggravates the liver and makes it not, for example, like converting T4 to T3, for example, or makes somebody have high blood pressure later in life. So I believe that these organisms stay in the body because we're made of human microbiome. We have the virome, we have viruses that are part of our DNA, and there are things that can trigger. I'm going to come back to the point I just made in just a moment, but there are things that can trigger the viruses to wake up. The dormant virus can wake up. Would an emotional trauma, somebody was molested as a child, somebody was, their husband was cheating on the wife, and the wife now has depression from that terrible, experience of being let down and cheated on, and now it triggered the virus to wake up, and now the virus is activated when it was dormant before for 30 years of her life.
Let me stop you there, because I want to make sure the listeners kind of get to where we are keeping up with this here. So we both agree that toxins, environmental toxins, have the ability to trigger immune inflammatory processes in the body and lead to chronic illness and disease. And really part of our job is our own job for about ourselves is trying to reduce that burden as much as possible. As functional practitioners, part of our job is to say, hey, is this a possibility? We typically don't look at the toxicity unless it's just, hey, I drank a bottle of poison, right? That's typically when the allopathic model starts to really focus on the burden. But we're talking about organisms, and organisms, I think we both agree, don't have to but could be also another trigger of immune and autoimmunity and chronic inflammation and chronic disease. And again, this is a thing where I think allopathic medicine really focuses on the acute phase of an infection. And I think most people assume that if they have an infection, they get an antibiotic, it kills it, it's gone, never to come back again. Or maybe if it does, I just do it. But there are really a couple different stages of organisms in physiology, right? And maybe you agree with this, maybe you don't, but we talk about dormant, latent, and in the acute reactivating phase. Do you agree with those three philosophies?
Sure. Yeah.
So do you want to talk about those three phases for the listener and what the difference between the three of those is?
Well, I don't know if we need to go there because we never know where. I mean, I'm just saying like dormant, it could be there, as I was saying a few minutes ago, is that it's, and I wouldn't know how to tell if somebody has a latent infection, but I'll say with dormant, what if that virus is there and it's not activated, and then a trauma, like somebody had a head concussion or in a car accident, now that activated the virus, that stress.
Yeah. So,
but I do know that, again, but back to where I am, I'm sorry to interrupt, but the people who are coming to us have issues. They're already living with the problem.
Yeah. So for the listener, a dormant infection is like Sleeping Beauty, sleeping. It's not necessarily creating an issue. It's not stealing energy from the cell, from the tissue. It's just, think about like Sleeping Beauty. A latent infection, from my perspective, is when an organism is not replicating, but it's still there. It's inside the cell, it's hanging out, it's stealing resources from the cell, potentially still triggering danger signals from the physiology because it may be still leaking toxins out into the environment, but it's not reactivating and replicating where it's triggering a bigger immune or bigger response. And then the reactivated infection is like the acute reactivation. Oh, my herpes blew out on my lip again. That would be a reactivated infection. So we typically, when we're thinking about, do I have a chronic infection, we're thinking about the acute. Most people are thinking about the acute stage. I think most allopathic physicians are thinking about the acute stage, and we're not thinking as much about the chronic latent stage where there's an organism hanging out, creating a problem, but when you do your white blood cell count may not be really high where a doctor says, oh yeah, it looks like you have an acute infection. So, but these organisms, especially in this kind of specifically, I would think in that latent state are probably the place where we have the more of the impact, because we're not paying as much attention because it's not an acute issue and they're kind of below the surface, getting kind of ignored, yet creating chronic health issues. How would you kind of explain it from where I left?
I think what you just said is logical. I might just leave it there. I think what you said is logical. I just know that, again, that when people are coming here, it's, they've already been hit. They've been hit with it. They're like with COVID, like in a very bad way, or they've been living for years with Epstein-Barr affecting them. And I know that there's dormant, and I know that once it becomes activated, will it take months or years or just days for it to now show up as causing a symptom in a person? And that's very hard for me to quantify, but I've got to find the root issue that's in that tissue and deactivate it, neutralize it, get it out of the body. I just want to see the person recover.
Yeah. Well, I think the people that are coming to see us do have these chronic latent infections and they're not being evaluated appropriately, for sure. The issue becomes, why do they have it? So from your perspective, you're looking at it, you're doing your technique, which is unique, I think you said, to what you do, and you're trying to identify the infections and then provide a remedy for it. But isn't there an immune system in place to address these infections, to prevent them from replicating or prevent them from being in this latent state?
I think that, yeah, it's a very good point. I think that some things, but I don't know if you followed the research over the past couple of years with the COVID, where there was Dr. Zelenko, he was saying that zinc and vitamin D and so on that would help to not replicate. The zinc would not allow the virus to replicate. And people were getting well following a certain protocol. So I think that we're missing certain minerals and certain necessary components of our body because we have deficient nutrients. Many people, not all of us, but a lot of people are deficient in certain nutrients and minerals in the body that help the body to have a better immune system function. I think that when people tell me that they haven't gotten sick in a long time, since they were a kid, like 30 years ago was the last time they got sick, I think that that's not always a good sign. Is the immune system really working at top speed? And to go back with the dormant and latent and now activated a viral or bug that's in the body, was that immune system doing the job in that latent stage and before it really turned on that bug? So is that immune system really up to speed? And then when we think of the immune system, we've got part of our body's immune system is our lymph, right?
Mm-hmm.
Part of our body's immune system is our spleen. That's part of that immune system. Part of our immune system is our stem cells in our bone marrow that make these white blood cells. Part of it is our thymus gland that helps to mature the white blood cells. Part of it is our tonsils. How many people have had their tonsils taken out because they were swollen?
They're
and
extra.
The doctors didn't have the right answer. Yeah, right. So, again, if a child's born with, let's go back to the stage of development. Let's say that the mother, I'm not blaming the mother, but let's go back to embryo and fetal development. What if the everything is going fine in the first or second, trimester, right? 6 months, and 6 months, the mother has a terrible, terrible toothache, and the tooth broke, and the dentist, I'm not blaming the dentist, but the dentist injects it with a chemical, the numbing agent, and gives an antibiotic and does a root canal and doesn't sterilize the tooth because they can't. And so let's say that numbing agent and the antibiotic and the infection from the tooth goes down to the 6-month-old fetal, baby developing in there. And now the baby's born with these toxins, amongst others that, well, like I talked about the body burden study. What if these are all, it's in the body and the body's immune system is already like in the lymph. The lymph has in it the antibiotic and the lymph, and the baby couldn't clear it. It wasn't developed enough. What if the dental anesthetic is in the lymph? What if the epidural they gave the mother right there at birth got through the umbilical cord into the developing, the baby that's coming out of the mother, and that baby's tissues, like the bone marrow, absorbed some of that epidural, or the brain absorbs some, because the brain, right, the body has to work together in unison. The nervous system, the lymphatic system, the immune system, the blood development, the endocrine system, the organs, everything has to work together. And when we have a domino effect, one system is down, others can be decreased in their function, right? So I feel that we're too burdened. And I think that there are infections, again, I said, can come from the mother, unfortunately. Fortunately, we're alive and we love our mother and owe her that at the very least. But get mosquito bites now that come at us, and there could be parasites, malaria, there could be mold, there are things from the mosquitoes, and then there's people coughing, and there's just so much. There's just so much. We can eat food, get, like a food poisoning, it's called, because we ate a hamburger or a piece of chicken or something that had salmonella or had a parasite in it. And even though it seemed to be fresh and smelled good and tasted good, but you get sick later. Did that infection ever leave the body after you took Pepto-Bismol or an anti-diarrhea medicine? You had diarrhea, you threw up, but did the infection ever leave? So I think that, and I'll tell you, on the opposite end of this, my grandmother, who passed when she was 99, let me tell you something, that woman was never ill. She was strong. 99 years old is when she died, right before her 100th birthday. She was strong. She had never had disease. She outlived 3 husbands. The brain was sharp. The personality was there. She was not weak until the last 2 months of her life. Everything just went down quick. So was there a latent something that was developing that went on? I don't know, but it's just incredible. She just had that incredible genetic, makeup that kept her strong right until the very end.
And she was still exposed to all the organisms, and she was still exposed to all the toxins, right? And I would say that was a person who went through these hormetic stresses, right? Had burden, addressed it, right? Her immune system was able to manage it. She had those ebbs and flows, high stress recovery. And I think for a lot of people in today's world, there is no recovery phase. And so it just continues to build the burden.
Yeah.
And the analogy I give my clients is, hey, imagine the stress of your life is like having 2 cinder blocks with a plank going across it. And every stress of life is like a 5-pound weight. And as you keep going through life, you're never taking those 5-pound weights off. And at some point you exceed the capacity of the board and the board breaks. And that's the load that broke it. You look at it like it was the last 5-pound weight you put on there, but it really wasn't the last 5-pound weight. The last 5-pound weight was what exceeded the capacity, but it could have been of any 5-pound weight. It could have been any trauma. It could have been any infection. It could have been anything. You exceeded the capacity of what your body could recover from. And now you're in this allostatic chronic regulation that you can't get out of. How do we fix that person?
Yeah.
Do you remove the last 5-pound weight? Probably not. Well, you got to, but the board's still broken, right? What do we have to do? We have to start looking at all those 5-pound weights and start removing them and saying, hey, this infection, this toxin, this thing, we just got to keep working our way through. And then we clear that board off. We can then rebuild that board, reinforce it. Now it's stronger than it was before. And we can start putting some stress back on the system and not have the physiology break down. But I think what most of us do is we just keep adding to the burden, and there's never a recovery. And you know those people, I know those people, they seem a little bit of stress, they go right into broken, like, everything's, I'm so exhausted. What happened? I yelled at my husband and now I can't even function. I'm exhausted I can't even get out of the bed. What? Okay. Yeah. You are right on the precipice of that, what you could tolerate. And now that's why that little stressor, your husband putting the glass on the kitchen counter when you didn't want him to, was enough to break you down and cause you to be incapacitated. Right. So we're going to come up on time here. We talk about toxins. We talked about organisms, how they can have an impact. What is your suggestion for people? How do we, what's the best process for trying to figure out what's creating their stress response? What's driving theirs? Do you have a thought process? Like, what is the strategy? Obviously, you have a special technique that you work with people, and we don't have an hour to explain the technique, but what are simple strategies and recommendations for people who are struggling with chronic health issues that you say, okay, here's the places to start, things that you might be able to do on your own? And then what are some other ideas or concepts that they might want to consider to trying to identify their root cause issues? So let's go with what can they do on their own to help?
Well, people can
address
try
their
with,
issues?
different diets. You might agree. I mean, certain diets with some people can help to reduce the stress. Maybe they reduce their oxalate load. They have to take out some nightshades. Maybe, some people are noticing changes, some, not all, but with a gluten-free type of diet. Some people with dairy, removing dairy from their diet. But there are other people who have really sensitive systems and they're overwhelmed with different infections and toxins where they take out those certain food items, like what I just mentioned, and it doesn't make a difference. But people can try that first. Even all the grains. I mean, in some people, it's not just wheat and it's not just like corn. It could be rice even that's hurting them. So going with certain gluten-free powders or, like a potato, what do you call it? A pancake mix or a bread, it may not be okay. Because even the yeast that's added to a gluten-free bread, for example, might upset the person's system. But I think that dietary, a clean diet, organic only is what we do in our house. We do a lot of vegetable juicing, fresh pressed, cold pressed juices is what we do every day. I'm lucky my wife is an excellent cook and she's an excellent juice maker. A low sugar lifestyle, because sugars feed organisms, whether it's viral or candida or other organisms. Everybody loves sugar, the taste of it at the very least. And organisms in the body love the sugar too. So cutting out sugar, doing your best to cut out sugar is going to help to reduce the stress load on the body in part. I think that, good meditation is good. I think that trying to, getting away from the stressful environment. If somebody just hates their job and the job drives them to have a headache and be fatigued every day, find something else to do in life. I mean, there's always an exit, right? There's always an exit ramp on the highway. You can go to a different town if you want. In other words, you can change your job. I know I had to, because I realized that there were certain things that weren't working for me, and it left me very stressed and puzzled at the end of every day of work. So we can change our direction in life. I think that if there are certain relationships that are a part of the problem, either we have to eliminate that relationship or we've got to do something to fix it. I think that detox strategies, people can try things at first and see if it does benefit them. And there are people who do different detox strategies of certain, they bought like a liver detox or a kidney detox system or a gut detox system. And people can do those things, or like a leaky gut repair type of protocol, they can do that. And there are people who do notice a reduction in their symptom. So I think that's a good starting place. I think that for a good percentage of people, though, I don't know how to quantify that when I say the word good percentage, but I do think that there are people who, where they do these different strategies, are not going to get better. I mean, even adding minerals to their diet, you know, people have mineral deficiencies. I think those are good strategies. Drinking very clean water, that's important. For me, I only do distilled water and with minerals that I add to it, because the water, even coming out of a filter system in a home, even reverse osmosis water that had a UV light on it, was supposed to be like the ultimate, that some people reported to me. I tested their water and it had mold mycotoxins in it. So the UV light in the RO system didn't count the mycotoxins. So, but very clean water is very important. Keeping dental health, brushing and flossing every day, obviously. But if you got a root canal, I think it should be extracted. I'll get right to that. I think that the mercury fillings in the teeth need to be replaced with the white fillings. So, but in basic, I think good diet, exercise, of course, stretching, breathing, deep breathing air, and maybe people want to do things like yoga or something like that. But in the end, there is going to be a certain percentage of people where they can do all these different strategies, and it's not going to help them reduce the stress load on the body. It's not going to, or it might help reduce the stress loads, maybe correct that, but it may not reduce their symptoms.
So, and I agree. I think those are the things I talk about in my book quite a bit is, hey, these foundational principles we all need to do, regardless of whether you have a thyroid condition or a cardiovascular condition or a gut issue. Those are just foundational things that we all need to do. The problem is that sometimes we've been in this dysfunctional physiology for so long that we actually have to do more to help pull that system back into a more homeostatic regulations, because it's been in an allostatic state or adaptive state for so long. And then there are situations where, hey, I've changed my diet, I've changed my lifestyle, right? I've exercising, I'm doing those things, and I'm still not well. That's where I really think people need to reach out for somebody who can help them. And I think the functional medicine perspective for a lot of people who are failing under that allopathic model is a good strategy. The challenge becomes for people like, but who do I see, right? And everybody's got a little different thought processes and techniques. You have your own technique that you've developed over time. So in the short time, I know it's hard to explain what it is, but what do you do? Can you give the listeners a little bit of information as to like what you do that might be a little bit different? And then we'll just send them to your website if they're interested in what you're doing. And I know you have an ebook, so they can get that and kind of take a look at what you're doing, but maybe in a very simplified version, how would you explain what you're doing and why it's different?
Thank you for giving me the opportunity to share with your listeners first. And
Sure.
I appreciate so far this whole discussion. You're a great host, and it's an enjoyable discussion with you so far. Science based on biophysics research, and some of your listeners may know the term Rife machine, where frequencies, that's not what I use. I did have one in the past. I don't have it anymore. I sold it. But the idea of frequency, meeting the frequency of the infected the organism that's infecting the tissue, the frequency of the toxin, of the lead or the mercury or the anesthetic that's in the brain or the kidney. We're able to meet the frequency of that organism or toxin with its identical frequency in water. And what these biophysicists discovered, and there's a video that people can look up online, it's in my ebook, it's called Water's Memory. That's on YouTube. I think it's maybe an hour in length, Water's Memory. And what these biophysicists in Europe back in the 90s started to discover is that we can imprint the frequency of the infection in the water, or imprint the frequency of the toxin in the water, and give that frequencied water to the person. And like homeopathy, like cures, like the body can use that frequency, just like what the Rife machine talked about, where the frequency of, let's say, a virus, you can match it and knock out that virus in the tissue. We give these water-based frequency imprinted into water remedies to get rid of the organism or the chemical from the exact organ. And that's the basic of it. It goes a little deeper than that, but that's the basic of it. So, for example, if somebody had hookworm in their stomach causing their acid reflux, we give them a stomach and hookworm remedy. It's got the frequency of a perfect human stomach, the frequency of that hookworm at a certain potency level, strength level, and it will knock out that hookworm from the stomach and stop the acid reflux, for example.
So for the listener, I'm going to give you like my interpretation of what you just said. Okay. Think about a glass, right? When the opera singer sings and the glass is vibrating at a certain frequency. Now the opera singer's voice gets to a certain frequency, and when it matches the same frequency, the glass shatters, right?
Yeah.
They didn't touch the glass. It was just the frequency matched and it broke. And I think what you're saying is, hey, what I'm looking to do in my practice is identify potential triggers of chronic inflammatory issues, autoimmune issues, what those underlying toxins or organisms are, and then try and find a frequency to match that through your technique of what you do. Change your I forget how you said it, but you're making the water match the frequency. And then as that water enters the body, it disrupts the toxin or the organism. Is that?
Basically, but I don't try to find the frequency. The frequency is embedded in the water. The samples I have, like the influenza virus, the Epstein-Barr, the COVID, the black mold, the parasite, it is its own set frequency, like a radio station has its own radio wave or frequency, right? You go to 105.9 on the FM dial, it's not going to play. If you turn it down to 105.5, it's not the same frequency. It's not identical. You won't hear that music or the DJ. So you are right when you said what you brought up before about the opera singer. When that frequency matched the glass's frequency, it reached what Reif described as a mortal oscillatory rate. It just makes that whole glass, once you meet that frequency, it just destroys the components of the glass. So when we match the exact frequency of that organism that's in the tissue, and we see the person's body in the type of exam I do, which I describe in a video that's on my website, and that's in my ebook. When they click on a link, it takes people to a 42-minute video where I'm describing about this technology, which is too much to describe right now. But it's the matching. Let's just say, for example, that the frequency, the energy of, let's say, the black mold in the thyroid, for example, the black mold is a 105.9. We make the remedy that's identical, the 105.9 mold energy that's now in the water. When the person takes that remedy, it only meets 105.9, meets 105.9, and it will destroy it. There's actually a video that's 33 seconds in length that's on YouTube. It's a killing parasite frequency video. And they show this cell, a lot of cells it's a black and white video under a microscope, and there's a lot of other cells, if you will, swimming around in this fluid. And one particular cell they reported had a parasite in it, and the frequency was 1150 hertz. So they put the energy of the 1150 from a device, they put the 1150 energy towards this fluid, which had all these different cells, but only one was infected with the parasite. Only the one that had the parasite was destroyed. The other cells were not harmed in any way whatsoever. It's only the identical energy. So that's a very interesting proof of this as well. But yeah, we match the frequency, and we see, like the little girl I told you about earlier, that autistic behavior stopped right here in the clinic. It's not always that fast, but that was just mind-blowing when it happened. It was the antibiotic that was in the brain that we got right out.
Well, I appreciate you being on the podcast. We probably could have talked for another hour or two, but we cruised through an hour and a half with like it was nothing. So I appreciate you coming on the podcast. We had an interesting discussion. I'll link, I think you've sent me the information. I'll link to your website and the ebook and the video so that people can watch it if they're interested in finding out more about what you do. Is there other places? Do you have the ebook? Do you have a website? We'll post those things. Is there other places that people can find out about you?
We've got Instagram and Facebook and YouTube, or basically where I share information.
All right. So we'll put that stuff out there.
Thank you.
For the listeners, yeah, this is a little bit heavier conversation, but I think it's a good conversation. But at the root of what we talked about today are still some of the foundational things that I talk about a lot of times. There's a load, there's a burden, and the solution is not just playing whack-a-mole with lab values. The lab values are the indicator that there is some adaptation, there is a problem going on, but they are not the problem. And what Dr. Herman's talking about, what I talk about on the podcast, is we need to ask better questions like, why is the body adapting this way? What's causing the body to behave this way? And if we address it or look to identify those root cause issues, that's how we're going to have long-term success. It's not by playing whack-a-mole with a drug and a medication to try and make the blood look good and make ourselves feel good. Because as what I've seen in 27 years is that you have your honeymoon period and then you're right back to where you started again. You're not in a healthier situation. Some people, yep, lucky enough to get a thyroid medication or get a medication, they feel fantastic or awesome. But I think my bias, because of the population I treat, I'd say Dr. Herman would say the same thing, that based on the population that he treats, there's a lot of people struggling with chronic illness. And what we're doing right now doesn't really do a great job with helping people recover from chronic illness states. So once again, Dr. Herman, thank you so much for coming on the podcast. And for the listeners, stay tuned, listen to this one maybe once or twice, and then share it with your friends. All right, take care.